If you're interested in getting better clinical results for your patients and become the go-to person for health and wellness in your community, then this video is for you. My name is Tal and I'm the Educational Director at the American Academy of Functional Health. And in this short mini class, I'm going to show you how to go beyond symptom management and utilize the functional and integrative approach to get better clinical results. This all lies really in the 3-level of care system, and I'm going to show you each level and how it can be used in your practice. This system comes forward because of our biggest challenges in healthcare. When we look at the statistics, 6 out of 10 Americans live with at least one chronic conditions like heart disease, Alzheimer's, depression, or diabetes. And when you look at the overall statistics, we see that the diseases like diabetes are the leading causes of fatigue, nerve pain, headaches, kidney failure, and lower limb amputation. And when you look at the overall surveys, this is just an example, but when we look at the overall chronic patients, 70% of patients with chronic diseases are feeling frustrated. This is according to a survey that was done in the University of Georgia. So 7 out of 10 patients are frustrated. And so this is where we dive into the 3 levels of care. And the first one is integrative management. So integrative management essentially means that we're combining the therapies that you're already offering, for example, drug therapy, or if you're doing whatever else you're doing in primary care, mostly drug therapy, with additional recommendations to improve the patient's health and function. These are simple recommendations, right? We're still on a very superficial level. It doesn't take a long time, but these are very specific evidence-based recommendations. I'll give you an example. Patients come in to see you, they got a diagnosis of type 2 diabetes, and we're trying to help them to improve their health and function. The most simple, straightforward way is to discuss the use of certain herbal supplements such as cinnamon. There are several interesting studies that I wanted to mention. For example, this one about reducing insulin resistance by activating insulin receptor. Another one is that cinnamon mimics insulin, which allows glucose to enter the cell and activate glycagon synthase, which stores glucose as glycogen. Again, these are strategies to help improve insulin sensitivity. And another example is the probiotics for patients that are already in metformin. This is a study that was done with 156 patients with type 2 diabetes. Average age was 51. Group number 1 received only metformin. Group number 2 received metformin plus a very specific probiotic that is called a Bifidobacterium animalis sub-sp lactis, referred to as BB12. And the result the authors reported after 3 months was greater hemoglobin A1c reduction in the probiotic group, improvement in treatment compliance, right? So more patients were able to stay on metformin longer term because they had fewer gastrointestinal side effects, less abdominal pain, less bloating, less diarrhea in the metformin and probiotic group compared to just metformin. And I put the citation there. You can read more about it if you like. But this is an example of how simple strategies of integrative management can improve your clinical outcome. The next level, as we go a little bit deeper with patients that are a little bit more committed to their health, is the proactive wellness. Now, we call it proactive wellness because in comparison to the standard of care, when we are reactive, here we are more proactive, right? So this would be changing the patients, talking about nutritional strategies or diet or certain lifestyle to support healthier function. Here's an example, the Mediterranean diet and risk of type 2 diabetes. There are multiple studies talking about if a patient just adds a few fruits and vegetables or adds some legumes, nuts, or whole grains, if they utilize olive oil instead of other types of cooking oil, if they consume lower amount of red meat, processed meat, or sugar, sweetened beverages, then they essentially increase their intake of dietary fiber, vitamins and minerals, and antioxidants. And the results are that adherence to Mediterranean diet is associated with healthier body weight, reduced risk of cardiovascular diseases, improved sexual function, and improvement in glycemic control and insulin sensitivity, right? So this is simple strategies that we can recommend for patients that want more proactive wellness. And then the third level is the deepest level when we actually do functional medicine, right? We focus on the clinical functional medicine. So we focus on finding and treating the root causes of insulin resistance and type 2 diabetes, right? So this is a more functional, or what we refer to as root cause. There are multiple factors we can look into that can contribute to insulin resistance or a decrease in secretion of insulin. And I'll give you a few examples. This is something that we often talk about, the gut microbiome. And here's a really cool picture from a study that was published in 2025 in the Journal of Discovery Medicine that shows that the imbalance of the bacteria in our gut that have important multiple functions due to dietary changes, antibiotics, environmental factors, or genetic factors, right, can lead or contribute to diabetes, obesity, inflammation, and even cancer, right? And this is something we can test. There are specific tests and there are specific treatment strategies to improve the gut microbiome. Another factor we look at often is environmental exposure. For example, there's an interesting study was published in the Journal of Clinical Endocrinology and Metabolism that showed an association between exposure to BPA in plastic bottles or containers and insulin resistance. These are the same strategies that our graduates, both nurse practitioners and medical doctors, are utilizing to develop a successful practice, get amazing clinical results for their patients. And if you're interested in more information, check out our functional medicine programs. Take care for now, and we'll see you in the next class.